1 year, so much has happened. So many partnerships were already developed. We were able to put together with partner organizations and the community health workers from different communities, the Native community, Asian community, African American community, Latino community, for many different. I think it's the first one unique in a sense of diversity and different voices. So throughout this year, we were able to really have the collective running started. We have a logo, we have participation of like around 30 community health workers already, and we wanted to engage you guys to be more present and to do this as collectively.
My name is Ana Paula, and I direct a program called Proyecto Salud at Coral Centro, and I have been deeply engaged in the development of the community health workers model in the state of Wisconsin. We're really pleased with the results of the second Minority Health Month event. And we really want to thank all the partnerships that we had with community organizations and the Minority Health Program in the state health department, who really have been a deep support for us. We're really aiming to shift the public health in Wisconsin. We really want to make sure that all the affected individuals and communities from different ethnic backgrounds are deeply involved in the steps of public health. In order to really make health equity a reality in Wisconsin, we really need to rethink the way we're collecting the data, the way we're making policies, how the policies are affecting our communities. We need to listen to the community to learn all of this, how we're allocating funding, how we're developing our programs, how we're integrating the community work to the healthcare system. So in order to reach this goal and to really make sure that we are touching all those points, we have been investing in the growth of the community health workers model in the state of Wisconsin. This has happened nationally, and we're really excited to have a strong voice of the community health workers in the state of Wisconsin. Together with many partners and the state health department and academic institutions and the health workers on the ground, we're developing a unique model where community health workers from different communities, from the African American community, African refugee, Asian, Latinos, Natives, we're all engaging together to learn from each other. And organically, United Voices was formed.
Community health workers are important because they provide a holistic, connected support to communities, not just around health in terms of just health, but in terms of the whole person. They bring that to the community, that force. The African immigrants do not have health care access, and so it's critical to have the health promoters available to help them to gain that access. And that's why I'm excited about the work that I do in preparing those health promoters to know the resources in the community and tie their communities into those resources. I support United Voices, first of all, because I'm an African and we believe in collective work. And, this is about collective work, because in our tradition, what happens to me happens to you. So if you're in pain, I'm in pain. And so by us all working together, we can help our community, the whole community, be healthy.
Taken together, think of it as an army of advocates for change. Taken together, it is the collective voice of folks who wake and work and worry and wonder and worship right here on the South Side and around the state. So I support United Voices because it is the way for the community health worker movement to come together and make a greater difference than just one program or one person. And the voices need to be heard, and the voices need to be invited. And by having a mechanism that allows that conversation to happen, like United Voices, we're going to be stronger and healthier as a community and as a state.
So I think community health workers are important because they have greater access than I do as a researcher into folks' homes, into the community in ways that most researchers just never really have that level of trust and inclusion. So they're able to actually get information that as an academic I'm maybe not going to get because they see me come in a white shirt and a tie and they think certain things. And so having more of an overarching organization to push that those ideas forward is critical to having that, again, that extended reach, both in terms of healthcare for the folks in the community and also to get research information back into these healthcare systems so that we can tailor what we do better.
The Chronic Disease Prevention Unit is invested in community health workers because of the impact that they have on health disparities, and especially in the area of chronic disease. Community health workers are an important strategy in this work that we do on a day-to-day basis. They bring the voice of the community to our work. One of the strategies that we are working towards is creating a path to sustainable financing for community health workers. We would like to bring aboard Medicaid and Medicare as well as private insurers to reimburse the work that community health workers do. The Chronic Disease Prevention Unit is excited to work with United Voices and the community health workers that are part of United Voices because they bring a unique perspective that is outside the walls of government and institutions. They walk the path every day. They understand what is needed to make a difference. And time after time, strategies have failed to impact health inequities. This is a fresh chance to make a difference and to improve the health of all Wisconsin residents.
I think community health workers have a unique opportunity to identify with families, and families identify with them very quickly and trust them. And they have an opportunity to help families build trust in the healthcare delivery system. And I think that is unique, and that is essential to helping us address health disparities, particularly among underserved populations. United Voices brings community health workers together who are working in many different facets. They might not be working for a healthcare system, but they can bring what they're learning from working with families, and collectively our voices are stronger.
I am a community health worker, but I also do volunteer time with Proyecto Salud here at Coral Centro.
Due to personal issue, I have a very big passion about domestic violence and sexual assault on a victim and survivor. So that's where I'm at, and I help, assist thousands of clients every year due to those two issues.
We promote breast health awareness among the Native American women in the community, and we also do outreach to the reservations in the state of Wisconsin.
I started working with you in the beginning with CORE, and I went through a training, and then from that training I met Maria Barker, and I've been working with her at Planned Parenthood ever since, and I've helped her to train a lot of the new health promoters in terms of community organizing.
I would like United Voices to have every culture be involved because I think if we get together, we can come up with one mission that we can make a difference in every community.
So United Voices has been growing the last year. We already have a strategic team of community health workers. We already have a leadership team of community health workers. We're developing a newsletter. We're going to have a website. We're really excited. The community health workers are shaping this movement, and hopefully it's gonna grow, and then we're gonna achieve the whole state of Wisconsin.
I saw an army. That's what I saw. I saw an army. We were all teal in this color. I saw our group on the front page of a paper just, while we were sitting here. And then the song came to me about, I hear the chains falling. There's an army arising. There's an army arising. I hear the chains falling. So we're going to do it.